Good morning, guys. Salam, namaste. Your lifestyle coach KUNAL Sharma here. So today is a very important topic about heart attacks. So you have to pay attention. Spread this message as many as people you can, because lots of people, educated ones, they don't know what are the weird symptoms of heart attacks. The first thing first, what is heart attack? One name is called myocardial infarction. Okay, that is the pain in the chest. As simple as it is. It is the most prominent symptom of heart attack. So you should not ignore it. Okay, if you feel whenever a little pain in the chest, just go for ECG or go to your physician, check it. The other symptoms, before we discuss, we have to understand why we are getting heart attacks, especially in the morning time. So there are a lot of digging, okay, before we come to the point. So it is not as simple as it looks like. So why we are getting heart attacks in the morning? First, we have to understand that it is connecting with your circadian rhythm. Okay, what is circadian rhythm? Moon set and sunrise. Okay, that is called circadian rhythm. We have a super chiasmatic clock in the brain which is aligned with the moon and the sun. When we break this cycle, this circadian rhythm, and we keep on pushing our sympathetic nervous system, it's called sympathetic tone. Okay, in other words, sophisticated word. So if you keep on pushing and there will be an imbalance between sympathetic tone and parasympathetic tone, that time you will get heart attack. That is the beginning. Okay, because your heart is working non-stop, your brain is working non-stop, your liver is working non-stop, kidneys are functioning non-stop. You are not giving rest internally, you are not healing at all because of the sympathetic tone. Okay, your adrenal glands are working too hard. So these are the things which creates heart attack in the morning. Now, before we discuss what time in the morning, so it's supposed to be 5 o'clock to 10 o'clock. If you check the data, the maximum heart attack happens in this time. Why? The first thing, as I mentioned, circadian rhythm. The second thing is when we are not recovering non-stop and we are pushing the body in marathon races, decathlons, iron marathons or gyms to 2 hours, we are creating chaos inside our body. We are not relaxing at all. We are not healing. We are not rejuvenating. You have to understand this line very carefully. All guys who are going to the gym or who are about to go to the gym, they have to understand this line very carefully. The amount of training and the frequency of training is not important. It is important the intensity of the workout. So that means you're not supposed to train 6 times in a week or 7 times in a week. It is 3 to 4 times in a week maximum, and the intensity should be good, and your mind should be connecting to your muscle, to your cardiovascular system, every organ of your body, every cell of your body when you train. Is that clear? Now again, the first thing was circadian rhythm. The second thing was recovery, because you're not recovering and you're pushing it. The third thing, the most important thing is when we get up, when you are in the bed, your blood pressure and your pulse rate, your core temperature is low. When you get up from the bed, these all things rise with cortisol. Okay, so cortisol is a stress hormone. Cortisol is a good hormone. Please do not give cortisol a very bad name, because of lot of publication, lot of media, they think the cortisol is dangerous. No, the cortisol is not dangerous. It is a beautiful hormone which wakes you up, which makes you ready for the traffic, okay, for the meetings, okay, for all kind of stresses. The whole day the cortisol helps you. The problem comes in the morning. When the cortisol level is rising, you're not recovered, the blood pressure is rising, your pulse rate is rising, and you are above that pushing the heart by exercising. And that is also strenuous exercises. if you are doing little bit yoga stretches, little bit breathing exercise, slow walks is still fine. The days you are not sleeping well. But I guarantee you, this much I have a confidence with this 33 years of experience in my line, 90% population around the world, they don't sleep before 12. That means what? That means chaos. Nobody is recovered 100% mentally and physically. And they are degrading, degenerating their joints, their ligaments, tendons, and including your neuron function. Okay, so this was the heart attack next point. That is why we are getting heart attacks in the morning, because your cortisol level rise, and you're above that, you're pushing the heart rate by strenuous exercises. That is why most of the CEOs around the world and most of the youngsters around the world who are doing strenuous exercise in the morning, they're getting heart attacks. Some people are dying on the spot, some people are getting faint. So this is the main reason. Now, what are the weird symptoms? The first symptom, as I mentioned, is a chest pain. It's a frequent chest pain. So you have to take care instantly. That's the first simple symptom. Now the next symptom is jaw pain. Very, 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 very serious, guys. The jaw pain, if you have constantly, please go to the doctor. The next point is your back pain. If the back pain is not going, it is a symptom. One of the symptoms of the heart attack. The next point is in the center, near down the sternum. If the constant pain is here, exactly, not in the heart, here in the center, you have to go to the doctor. You have to check what is happening. These are the weird symptoms. If you have a tight calves, listen very carefully, guys. If you have a constantly tight calves, okay, please check, go to the doctor. If you have a pain in your toes constantly, that means you are not recovering. All right, you're not recovering. Your nerves are not getting enough blood supply. Whatever is happening inside your toes, it is because of the blood supply. The nutrients are not reaching, or otherwise there is a restriction, or there is a flow of blood is less from the heart. It can be any reason. Okay, so you have to understand that, okay, how important is my foot health, calves health, okay, even the whole legs. Anywhere, anything happens, a pain, a constantly, you have to be careful and observant. Okay, what is happening inside my body? Do not ignore it, guys. Left arm pain, if there is a constant pain in the left arm, is a weird symptom. It can be. Intermittent claudication. What is intermittent claudication? If you just walk a couple of steps and you get tired. That is the meaning. Okay, you are tired means you're not, your heart is not pumping the blood. So that means you will get tired. It is as simple as it is. All right. If you climb up the staircase and you get a shortness of breath, or just a simple walk, shortness of breath, and you need to take time to recover, this is one of the symptoms for the heart attacks. Your heart is not pumping the blood. The whole idea is how efficiently your heart is working. Now, how to check it that? Think for 1 second, sit down quietly, how we can check our recovery of the heart. The most important line is how fast our recovery is there, especially for those people who are exercising. So it's a simple test. You can do it to check, okay, in future you're getting heart attacks or you're safe. If you're exercising on a high intensity, that means 80%, 85% on your maximum heart rate, that is high intensity, for 1 minute. Train 1 minute, okay, and then stop, and then check your pulse. If it is less than 10 or 10, you are inviting the problem for the future. If it is between 20 to I would say 45 or 40, still you are okay, but it's a gray area. But if it's 40 to 60, your recovery rate, or 30 to 60 or 30 to 40 even, still you are in excellent shape. After the high intensity workout, how fast your heart rate is coming down, that shows your recovery rate, guys. So this is how you can prevent your heart attacks in the future. This is a very manual and practical test. Okay, so these are the symptoms and these are the things which you can do for the heart to prevent heart attacks in the future. This message should not be too long. Okay, it is the important message, so I'll break into two pieces. Next time we will discuss the second part, something else about the heart. So in the meantime, you take care and be safe whenever you train, wherever you train. Spread this message as much as possible so that maximum people can get the benefit out of it. So keep smiling and take care and have a great day. Love you all. Bye.